questions, or any of us that here? And
Dr. McDonald, do you have any willingness to take the job on a full-time basis, or do you want to rule that out?
Yeah, so I had a really great conversation with the governor the other day, and what I told Governor McKee was I want to help him. Tony Afonso was there as well. I said, I want to be helpful. And he asked me if I would help the search committee. I met with the search committee yesterday. We had a great conversation. I'm going to help them as well. So, part of what I just want to say to you and to anyone else is, let me help the governor right now, okay? Let me help in that search for a permanent person, and we'll see where that brings us, okay? But we'll look together, but I'm just going to try to be helpful at this point.
Your hat in the ring? You going to throw your hat in the ring?
I'm not trying to answer the question anything more than just honestly. I just want to be really helpful to the governor right now, and that's what I'm going to try to do. Is that fair?
If you were offered the job permanently, would you accept?
So let me just, I really like to just say what I mean and mean what I say. I just want to help the governor right now. And can I just leave it at that for today, if that's okay with you guys right now? I don't mean to not give you a more of a specific answer, but please let me just help the governor right now, and let's get through this time, and we'll see where it brings us, okay?
Governor, you said that you're going to have better relation, better communication now with your office and the health department. What happened before with Dr. Nicole Alexander? You going to have a good relation?
no, I think that we're going to continue. I want the people to know that the combination of the people that we bring in and the people we have over there right now, we intend to have good communication. I think that what I was mentioning was that with Pastor Chris being there, to have a more direct communication in a transition like this is really important. So we want to know everything that's happening in a way that, where before it was happening and it was doing well. I mean, we're not leading the country in testing unless there was good things happening. We're not leading the country in vaccinations unless good things were happening. But in a transition, I think that you need to be very proactive, and that's what we're doing right now. We're bringing in resources into the office, into the Department of Health, to make sure that this transition is very strong and that the people in the state of Rhode Island understand that we're doing everything we can, and we got a good team that's going to move us forward.
Governor, could you clean up exactly? It's our understanding Dr. Scott comes to you and says, I want to resign. You say to her, I want you to stay. She says no, 2-week notice, and then I'll have my attorneys contact your attorneys to negotiate. When a director resigns, where is the negotiation? Because she ultimately, in doing that, resigned her position as director of the state. Now, she's entitled to the money for February, but how does it go from, she told Channel 12 that you offered her the money. How does this square where there's a negotiation if she resigned?
Well, first of all, the sequence was similar to what you just said.
Okay.
The doctor said she had a window of opportunity in more than one meeting. I asked her to stay. Each time it accelerated, and there was a window of opportunity. When I have people that I work with that tell me they have a window of opportunity, we want to make sure that that happens, and that the transition, I ask for professional transition, right? So that's what's happened. And then in terms of, I believe there's a value to have, an outgoing director be in a situation where that we can, call on her if we need her. And there was certainly a negotiation in terms of what that value was. We went through that negotiation. I think we settled in a spot that makes sense. So for the state of Rhode Island and the taxpayers.
Did she refuse to assist unless she was going to be compensated $46,000 a month?
So I'm just going to be very clear again on it, right? The sequence happened as I laid out just now.
Yeah.
And it was a process over several weeks. As I said, it was a few weeks back. And there was a compensation in there that I believe that was made sense, and it was asked for, and we responded by saying, we'd like to have you on as a consultant. And I did offer that to her to come on as a consultant, and then we worked it out with the attorney. So I think that it is true that I said, consultant might be good. We really want to make sure the people in the state of Rhode Island are safe.
But she's not available the month of February.
She's available to us. She's on, she's taken some comp time which is legal to do and appropriate. And we certainly will have access to her during this time frame and during the
money. Would she have stayed? Did she say, listen, I think I'm worth more. If you pay me more, I'll stay? Is that what it was?
No, like I said, she felt as though she had a window of opportunity. That's her words. My words was stay, but if not, let us do a professional exiting strategy, and I believe that we are showing today that the people of the state of Rhode Island are being served very well by
So
that.
this wasn't a buyout? It wasn't a contract buyout?
No, no. And I think it's important that it wasn't a contract, by the way, right? That was statutorial, I'm gonna miss the words here, but she was on a 5-year, not an agreement, right? She was on a 5-year term statutorily, right? So, no, I think it's exactly what I just said. She said, the doctor said she had a window of opportunity. I asked her to stay. When that was not an option, we tried to figure out a best way to make sure that we had all professional hands on deck, and we've done that.
Did he tell you what that opportunity was?
No.
Governor, on the tests, would it have been better to have them here a month ago? You even said that Omicron, the cases are declining. Would it have been better to have these here weeks ago when people were asking for it?
Well, first of all, let's talk about testing. 175,000 tests in a given week, just 2 weeks ago. So we're leading the country in testing. So I want to make sure the people in the state of Rhode Island know that that's a success, what we've done on the testing. Bringing in supplies right now in terms of the supply chain is a challenge for everyone, but that's why I gave a shout out to Mark Pappas. When he came on a few weeks back, we identified areas we wanted to get supplies, and he went out and got them. And so now we got the municipalities handing out tens of thousands of home test kits. That's a success story as far as I'm concerned. And 175,000 tests in a given week, and we said numerically 2 times what the second place state had. That's an enormous workload, and that's National Guard, it's Department of Health, right? It's our EMA, it's our municipal leaders, all our nurses out there. They've stood up and led the country in testing.
Governor McKee, where are the tests coming from? Are they coming from the federal government? You also mentioned a couple weeks ago that you were reaching out to CVS
Yes.
and a company on the West Coast as well.
I think the first batch came from CVS and through a call that I had, and Mark might be able to kind of detail a little bit more on that question. If you'd like to do that, Mark, please.
Sure.
Vendors, private vendors that have been secured over time. Abbott, other companies, CVS, so that's where they're coming from.
And another follow-up, with the bulk of these tests, with all of these at-home tests that are going to be out there in the community, maybe this is a question for Dr. McDonald, are you concerned about the lack of self-reporting? Are people self-reporting these cases to the DOH? How is it changing the percent positive in Rhode Island? You say that Rhode Island's a testing leader, but are we still going to be a testing leader?
Yeah, there's no mandate for them to report, so we know the numbers are a little low. If Dr. McDonald wants to take that.
Yeah, let me
fine.
just thank you, Director.
Sure.
So yes, obviously, not everybody who has a self-test is going to report to us. It was at the Senate Oversight Committee Monday night, and Senator Acosta explained this to me too. He said his kids were positive, he tested positive, so it's and he did the responsible thing, he did the right thing. He had self-tests and he used them, but he didn't know we have a website. So we have a website people can self-report. But yeah, we're not going to get all these people self-reporting to us. We understand that. So, it is going to change things. I'm following the hospital numbers a lot more closely, though. One thing that's kind of interesting now is even just compared to 8 days ago, there's 100 less people in the hospital than there was 8 days ago. Our hospitals are still stressed, still a lot going on there. They're still limiting what they can do here, but that's something where it's going to be more important to look at that. In aggregate, though, think about it this way. There's a lot of people doing self-tests. Some are going to be positive, a lot are going to be negative, but the main message I want to drive home to folks is if you've got a self-test, you've got to know what to do with it, right? So it's really when you start having symptoms where you think you might have anything. Because one of the things about Omicron COVID is it just surprises people. It's subtle, and people just, I felt okay. And it's so somebody, an amazing number of people tell me they have it. They're just like, it just came out of the blue. And a couple days into it, and they didn't realize it. And the thing is, why I want you to test early is I really prefer you not running around town positive for COVID. And, if you have symptoms for a couple days and you're running around town, you're just spreading it all the more. So that's why I need people to do that. So I hope that helps.
Dr.
Pat
McDonald.
had one more question, John. Pat had a question.
Dr. McDonald, last week the CDC released some reinfection data from California and New York that showed national immunity to be superior to vaccination for preventing hospitalization and reinfection. Johns Hopkins University showed that the protection offered by natural immunity will last longer than that provided by vaccination. In light of these developments, is it in fact time to get people like Dr. Scully to get the fired healthcare workers back to work? Is it time just to move past this seeming obstruction against scientific fact.
Yeah, so I think we have to look at all the studies that are out there. And one of the things is like, in the short term, and this is not surprising, right? In the short term, you're going to get natural immunity will last, but it doesn't last as long as vaccine immunity. One of the things we had recently on our podcast, Dr. Chin and I do a podcast called Public Health Out Loud. We had Dr. Joe Hogan on from the Brown School of Public Health, and he really looked at Rhode Island data. We have Rhode Island data that shows people who are vaccinated are doing better than people who are vaccinated, unvaccinated in reinfection. So reinfection isn't offering protection. And one of the things you need to remember, this was true in the beginning of the pandemic, it's true now, is coronaviruses have been around for a long time. You don't get long-term immunity from a coronavirus, and that's why the vaccine's so important. The thing I think people drive home, though, is that if you're not up to date, you haven't had those 3 doses, that's what I need people to do here. So to answer your question, no, I don't think we need to shift policy. What I do need people to understand is you really need to be up to date with that vaccine. So that means 3 doses of messenger RNA vaccine. If you're one of the 50,000 Rhode Islanders who got a Johnson & Johnson vaccine, you need a booster of that. You're good to go.
We're running out of time. We're gonna get to Lynn.
All right, so you're denying the CDC, basically, you're saying
Pat,
no
we
to the
gotta-
Center for Disease
Lynn
Control.
has a question, and then we gotta wrap things up. I wanna make sure everyone gets one.
Doctor, just
Lynn
what's your
and
reaction
Michael.
to the Washington Post story? That showed the collapse of Kent Hospital. We're the only state in New England that the Biden administration had to send people in. The Boston Globe talked about the collapse of Rhode Island Hospital. How is this, what was your reaction to Washington Post? It made us seem like it's third world care.
Well, there's definitely not third world care going on in Rhode Island, and very thankful to get the federal support we're getting. I mean, I think one of the things we need to underscore right now is our healthcare workers are working as hard as possible. There is no collapse of any hospital in the state of Rhode Island. They're still taking care of patients. They have limited services, not doing as much elective surgery, but getting the supplemental staff is helpful. And this is a good example of how federal and states work in partnership. One of the things you see right now is Rhode Island we're dropping down, but other states are going to be in a different position here. We're going through our Omicron wave. We're through this season almost. So we're heading in a decent direction. So our hospitals are in good shape. They're working hard. We partner with them all the time. They call me almost every day. I know what's going on in these places. My reaction is the people in Rhode Island are well served by our hospitals. The hospital workers are doing a great job, and I'm very thankful that they do that. And I think that we're going to be okay. And I think, quite frankly, in a couple weeks, 3-4 weeks, we're going to be in a much better place and maybe talking about something different. We'll see.
Lynn and then Michael, and then we gotta get things going.
Governor, this is directed to you. In Massachusetts, the governor created emergency critical care orders for the whole state so that all hospitals had to cancel or postpone elective surgeries. In Rhode Island, the 2 major healthcare systems, Lifespan and Care New England, have done this, but Charter Care, which operates several smaller hospitals, as you know, has not done this. My first question is, did Charter Care hospital CEOs or anybody else in that organization ask you specifically not to introduce those kinds of mandatory, postponements of elective surgeries? And if not, why did you decide not to make a statewide order to help relieve all of the hospitals?
Well, we left it up to the hospitals to decide, and we know that those who did felt as though they needed to take that action. And like Dr. McDonald said, we're in conversations with the hospital leadership around the state of Rhode Island, and they feel as though that they can continue to have elective procedures and still take care of the patients. And I think that's positive for the state of Rhode Island, quite frankly. And also, I know that Governor Baker did something that I asked several weeks ago, was to determine who's going into the hospital with COVID and who's going into the hospital that has to have COVID. And I think we're going to have, on Tuesday, we should have some pretty good, results on that as well. So we're monitoring what's happening in the other states. I'm in conversations with Governor Lamont. I'm in conversations with Governor Baker. And I think that, aligning what we do in some cases makes sense, and in some cases it doesn't.
Michael,
So
last
let me just
question.
follow up.
Or one follow-up, and then Michael, and then we're all done.
Do you not agree with the doctors that I've talked to who say that actually there is a ripple effect when you allow some hospitals to continue doing elective surgeries, that they are actually have less room in their emergency departments and less staff to handle other types of, procedures or emergencies, and that has a ripple effect on other hospitals, that they're affected too?
Well, with the infection rate going down, I believe that we've managed our way through the issues in the hospitals in a good way, and we expect that we'll have better news going forward. But we've taken some multiple actions relative to, you know, creating opportunities for nurses to get in the hospitals earlier than you know, procedurally. We also have done, we're working on urgent cares. We're working on multiple factors there. I believe it's working. Otherwise, we would be in a more difficult spot than we are right now. And right now, it's Rhode Island Hospital you're talking about. Lifespan. They felt as though that they needed to do that, and so we support that. And we've been through that hospital. I've walked through with the people there. And again, one of the things that's happened recently is the fact that I think that the FEMA staffing is going to be extended another couple weeks down in Kent County
So
Hospital.
did any of the hospital CEOs or any of their ask you not to make a statewide order? Yes or no?
No, none of them asked me not to do it. What the discussion was, how do you want to handle it? And they individually took it, you know, on themselves individually how to do it. So no one asked me not to do it, and I didn't ask them not to do it. They made their decisions based on what was in the best interest of what they felt as though was for healthcare in their respective hospitals.
Michael, last question?
Dr. McDonald, I realize that you've only been interim director for about 6 hours, but you've been here since the very beginning. And so I think this is a fair question. Knowing what you know now, and I understand you and everyone else have been chasing the moving target of science, what should the state have done differently, and even what did the state do even wrong or in a way that should have been done better? And how do you see going forward based on those observations?
Yeah, you know, hindsight's 20/20 is an old expression, and I'm not sure it's helpful. You know, I think one of the things I'll say about this is, like, you know, when you start getting into try to blaming entities, like, I've just never seen blame lead to healing people and making anybody stronger. So I don't mean to not answer your question directly, but I'm just not sure it gets us anywhere positive. What I would say about going forward is, what I'd like to see happen going forward is, you know, we need to get our population well more immunized than they are right now. You know, one of the things Senator DePalma brought out of the Senate Budget Oversight meeting, he says, he's looking at saying we're 34% up to date. He says, that's a problem. We got to fix it. I said, yes, Senator, that's the problem. Now we're at 36%, but that's the problem. The way going forward out of this season of the COVID, the Omicron season, is we need to get our population much more vaccinated. And that's going to help us get out of the Omicron season, but it's going to prepare us for next year. Because, by the way, folks, I don't know what the future holds. There's way more letters to the Greek alphabet. And what I want to make sure is we're protecting Rhode Island to make sure we're okay for the future. And that, my friends, is getting as many people boosted as possible. So if you haven't had that third dose, there's no waiting. We have a lot of vaccine availability, In the beginning, that wasn't the case. Like, if you think back to a year ago right now, what you guys were talking to me about was, how can I get more people vaccinated? And we were giving you everything we had at that point. Right now, though, we got plenty of vaccine. I just need more people coming forward with their arms, getting their vaccine. And I'm sorry there's a snowstorm on Saturday, because I know Saturday is a great day to get a vaccine, because if you have a little immune response, you can sort of go with it. But it's like, I can't control the weather. There's a lot I can't control. What I can say to you, though, is that we can control this pandemic if we want to. And it would help a lot if we would just say, what's our solution? Because my solution is putting that solution in your arm and getting you to get that third vaccine. If I can get that happening, we aren't talking about this. We're talking about other fun things over Rhode Island. So that's the best I can do for you right now.
Well,